Okay, y'all, welcome to the Lamp and Light Fellowship of Nurses channel, where the goal over here is to equip nurses and to change lives. And I do that by offering one-on-one tutoring sessions in the subject areas of med-surg, pharmacology, and also fundamentals. But we're going to go ahead and get into the question of the day. So this is the scenario. You have a patient. She is on Lasix twice a day. She presents to the ER because she has some complaints of dizziness, right? And on her presentation, she has a blood pressure, a manual blood pressure of 96/52. She has a weak 30 pulse, and she also has a heart rate of 113 and dry mucous membranes. So based on these assessment findings, what do you anticipate is another expected, exam finding for this patient, for you as a nurse? What do you expect to find as a patient? Do you expect to find A, headache, B, skin tinting, C, increased urine output, or D, weight gain? So you want to look at the question because there are obvious clues in the question. The question is pretty much asking you what's going on with this patient. And based on her presentation, you should automatically think dehydration in this patient, right? The first clue is the fact that she's on Lasix. Lasix is a diuretic, and it is a diuretic that can cause dehydration or intravascular volume depletion, right? So she can be dry. And also another exam finding that lets you know that this is dehydration is the heart rate of 113. Because typically when patients have, dehydration, they'll have like an increased heart rate to increase the cardiac output, right? So her blood pressure is low. She has an increased heart rate, and she also has dry mucous membranes. So when you have a patient with a dry mucous membranes, they may cry and you don't see any tears, right? You may get them to stick their tongue out. Their tongue is dry. You look at their eyes, right? And their eyes may be dry. This is a dry patient. Their skin may also be dry, right? So you look at their skin looks dull, it looks lifeless, they have dry skin. So based on these findings, you should, in your mind, you should be thinking, what else can I look for that lets me know, that goes along with an exam finding of dehydration, right? And you're looking for exam findings. So automatically you can already rule out headache. Because we said exam findings. Headache is not an exam finding. Headache is more of a subjective complaint. This is something that you can't really qualify or quantify. The patient tells you that they have a headache, right? And pain is whatever the patient says it is. So this is subjective data that you can't, you can't really put a number on it, so to say. It's whatever the patient tells you, right? It's subjective. So objective data is things that you can measure on your own. You can quantify on your own. You can qualify on your own, right? So the headache is not it, because again, that's a subjective finding. Also, you can't weight gain, right? If this is the patient's first day to the hospital, if they tell you that they have some weight gain, this probably not has anything to do with dehydration. And also fluctuations in weight, like when they come in for the first time, they may tell you that, look, I've lost some weight. So that would be like that's like a subjective finding. And then as the time in the hospital goes on and you see that they do have weight loss or fluctuations in their weight, that's going to be an objective finding because it's a part of the vital signs, right? And increased urine output. So if you have a patient with increased urine output, don't think, increased urine output. An increased urine output can cause dehydration. But as far as it being an exam finding, that's not what we're looking for. Because when a patient has dehydration, they actually have a decrease in urine output. So the correct answer is going to be skin tinting. Skin tinting is like this, right? So if you pinch on the patient's skin and their skin, it stays up like that. That means that they have some tinting in the skin. It means that they have poor hydration, right? So that lets you know that they're dehydrated. And also, if it's an older patient, one thing that you don't want to do, you don't want to check skin tinting on an older patient on their hand, right? Because in this population, they're aging, so they have some decreased elasticity in their skin. So when you check for skin tinting in an older patient, it's actually best to check it on their forehead or to check it on their chest, right? Somewhere along the sternum. That's how you check it in an older adult. So again, you never check it on the hand, on the back of the hand. So the correct answer for y'all is skin tinting. And this lets you know again that this patient has some dehydration. So that was the answer. If this has helped y'all, been helpful for you in any type of way, please comment helpful at the end. If there are some topics that y'all would like me to speak on, please feel free to put those in the comments as well. Please just make sure to comment on the video so that YouTube can pick it up in the algorithm and show it to more nursing students. Thank y'all.